Go ahead and get started. This is Ed Weir. Today we are going to have a full day as usual. We're going to talk about the top 6 filing mistakes. So I was the district manager of this the third busiest Social Security office in the country, and I know all the mistakes. I narrowed it down to 6. I've got other videos talking about other situations, spouse benefits, and all that, survivor benefits. But today we're going to talk about 6 of the top filing mistakes that's probably going to cost you money, benefits, aggravation, and all the rest of it. Might maybe even a receding hairline. So too late for me, but we might be able to help you out. So please press like and subscribe if you're new to the channel. I do videos all the time to help you out. My job in my semi-retirement is make sure you get all the retirement benefits, Medicare, survivor, spouse benefits, disability benefits you possibly can. And if you don't subscribe, then a week, month, next year, your friends, relatives might have a question and you won't be able to find us. There's just so much information out there, so many YouTube channels, and you might not need us today, but you might need us next month or in 6 months. After I finish the top 6 filing mistakes, then I'm going to open it up as usual for questions and answers. So if you're just going to stick around for the filing mistakes and you don't have any questions today, then we'll probably take about 10 or 15 minutes to do that. And then um, that'll be it for you. But again, make sure you like and subscribe. And that way, when you do have a question in the future, you can just come back. And invariably, Social Security always sends out, some strange letters sometimes. And so you might get a strange letter next month or, 6 months from now, and you're trying to figure out how, what it means in English. Then you can find us again, and we can interpret it for you, translate it into actual English from bureaucratic language. All right, let's get started. So if you've got a question today, go ahead and type it in the chat, and then once we talk about the filing mistakes, then I will get into as many questions as possible. We'll probably be on here for about usually it takes about an hour to go through all the questions, as well as many questions as I can. All right. So the number one mistake, these are in no particular order, is waiting. Yes, waiting to file for benefits for whatever reason. Usually it's, well, I want to go ahead and file for spouse benefits, divorce spouse benefits, or retirement or whatever like that, but I don't have my documents. You don't need documents to schedule an appointment, because see what happens is you have Social Security has what's called a protective filing. And if you're 62 this month, you have to be 62 the entire month. You've got the full month, so you have to be the first month you're 62, but the entire month, for example. And you're entitled to benefits this month, but you're like, oh, okay, I need a divorce decree, or I need this, I need that, and it takes you a month or 2 months to get it. You've just lost those 2 months. So don't wait. Immediately call Social Security and schedule an appointment, because your appointment probably won't be for a month or 2 months anyway, because Social Security is extremely backed up. And by the time you get the day of your appointment, then hopefully you'll have your documents. But even if you don't sweat it. The Social Security employee will say, okay, you might not even need a document. You know, um, your ex-spouse already filed, and he or she already told Social Security about the marriage or the divorce or something like that. So you might not even need any type of documents. Social Security changed the regulation a few years ago that most people don't even need the birth certificate anymore if it's proven in there. So yeah, so it's don't wait. That's super long story short. Don't wait, because you're going to lose that protective filing. So make sure you call and schedule an appointment and worry about the documents and all that other stuff later. All right, the number 2 filing mistake that people are losing money on is not evaluating whether they should do survivor benefits or file on their own. When you do spouse benefits, that is, you're you're currently married or divorced and you're going to file for spouse benefits and that person is alive, then you have to file for benefits on your own record. Okay. So you file for benefits on your own record. And then if your spouse's benefit is over twice your full amount, their full amount is over twice your full amount being at your full retirement age, then you're entitled to benefits on that person's record. So, but when it comes to survivor benefits, you don't have to file on your own first. So read my comments. I've done a couple of longer videos on survivor benefits. So watch those videos for a more detailed discussion of survivor benefits. But you'll see in the comments there, I wish I'd have known this. I've lost, thousands, tens of thousands, probably hundreds of $1,000s in my life because I didn't know about this. Basically, you can file for survivor benefits or you can file for benefits on your own record. You have a choice. So you can go ahead and file for survivor benefits. And the trick is you let your own benefits increase until it's your full retirement age or delayed retirement credits, which gives you another 8% every year for, from 67 to 70. So you get survivor benefits, even if it's a little bit lower, the same or a little bit lower to start off with. This is what a lot of Social Security employees, they kind of mess up. They don't give you your options. They're all inundated and whatever the case may be, but they don't give you that full information where they just say, hey, benefits on your own record is $10 more. Let's go ahead and do that. Forget survivor benefits. No. Maybe if you really need that $10, fine. But survivor benefits, even though it's a little bit less, go ahead and get that for a year, 2 years, 3 years. All the while, your benefits are increasing. And after a year, 2 years, 3 years, you didn't lose $10. You're now you're up, $100, $200, $300. So make sure you make those, you compare the amounts and what you want to do. Okay. So that's number 2 filing mistake. Number 3 filing mistake is when you are currently married and you're going to file for spouse benefits and your spouse is waiting to retire, the higher earning spouse. So again, this doesn't take into considering tax issues. Okay, well, if I start my benefits now, it's going to put me higher tax bracket. You can obviously take that all into consideration, and whether you're working. So if the lower earning spouse, the lower benefit spouse is not working or going to stay or going to stop working or under the earnings, the annual earnings limit, if they can go ahead and start their benefits while the higher earning spouse is going to continue to work. And, after they're going to retire after another year or 2 years or 3 years or whatever the case may be, the lower earning spouse should just go ahead and, a lot of people, they just go ahead and get their benefits. The lower earning spouse go ahead and starts their check. And then when the higher earning spouse retires, then the lower earning spouse can file another claim. It's not automatic. You have to file a spouse claim. So the higher earning spouse files a year, 2 years, or 3 years, or 4 years later. And then they, the phone appointment, they pass the phone over to the spouse and the spouse takes a spouse claim and gets the difference up to half of what the higher earning spouse gets. So again, read my comments. I've got a couple of videos on spouse benefits. I've got 2 or 3 videos on surviving spouse benefits and 2 or 3 videos I just did in the last month or so on spouse benefits. So this is called a split strategy. So again, the lower earning spouse go ahead and gets it, get while the getting's good, get that money coming in, and then it's increased once the higher earning spouse files. All right, take a break here, and I need your help to get this information out there. Again, read my comments. The comments people bring in. I wish I would have known this. I wish I would have known that I lost this much money and now I'm struggling, So there's so many people out there. They're not getting the correct information. There's so many YouTube and TikTok and all that kind of stuff that's giving out misinformation. People go to a couple of days of seminar and then they get a cute little certificate that says they're, Social Security experts. You know, it's, yeah, there's so much, and there's so much clickbait out there. Oh, you're going to get checks, and more checks, and stimulus, and wish they would stop it. But anyway, so I need your help. Please share, subscribe, tell your friends, contact your local news station. I'd love to, do a little, thing on news channels throughout the country. We really need to get the information out there. If Social Security customer service was where it should be, I wouldn't have to do this. I just did a video a couple of days ago on how we can improve Social Security customer service. But all right, so I just please, I need your help to get the information out there. Okay, number 4. Medicare, Part A, Part B, Part D, filing or not filing. So big mistakes there that people make. If you're 65 years old, or if you've been on disability for a couple of years, you're eligible for Medicare. And this year is the big year. 2024 is U.S. history record year. The most people turning 65 years old this year than any time in U.S. history. So there's a lot of out there. Was it 11,000 people a day or something or more are turning 65? So if you are working and have health insurance from work, and your employer has 20 or more employees, and you're happy with your health insurance, and it doesn't cost you an arm and a leg, and yada, 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 then don't file for Medicare Part A or Part B or D, or you don't have to. You do not have to. It's not mandated. You can wait a year, 2 years, 3 years once you stop working. And this is for you or your spouse's work, current work, not retirement or COBRA or the Affordable Care Act, Obamacare. It's not for that. It's only for current work. So if you are currently working and receive health insurance from work, or your spouse is currently working and receiving health insurance from work, and you're receiving that, then you don't have to file. So too many people file, and Part A is free. You can sign up for Part A if you really, really want to, unless you're giving to an HSA. If you're giving to an HSA, health savings account, you can't give to that HSA anymore once you sign up for Part A. That's another filing mistake. I guess that's number 7. So I'll throw that one out there for for free, I guess. All right. So yeah, but if you don't have that health insurance, then you do have to file for all that. And Part B covers, it's $174.70 this year. And a lot of people, say, oh, I don't need health insurance. I'm good. Or they say, I don't need Part D because I don't take prescription drugs. That's fine. But if you don't have other credible coverage for Part D, there's a penalty there. So if you don't sign up at 65, uh, and you don't have that other health insurance from current work, you or your spouses, then you will be penalized 10% for every 12 months you do not sign up for Part B. So there's a Part B penalty and a Part D penalty. So make sure you're doing the right thing. If you're looking to sign up for any of those, I put together a network of partners throughout the country that can help you, because Part A and Part B are great, but there's a lot of gaps in there. So if you're looking for a Medicare supplement or Medicare Advantage or a Part D prescription drug plan, I put together a network of partners throughout the country that can help you out. So please just call my number and tell me your name, phone number, your state, because they're all state specific, and what you're looking for. And we can find someone in your neck of the woods to help you out. All right. Okay, let's see here. And that's a free service. And those partners support our channel to, so we can keep doing these crazy videos. So everybody, please press like. TikTok, sorry, you can't see all my graphics, and I've got a green screen behind me here. I need 10,000 subscribers on TikTok to do TikTok right. So if you could subscribe and like and all that kind of good stuff on TikTok, so I can start doing y'all right here, I appreciate it. All right. Number 5, disability. If you're looking to file for disability, I hear all the time people says, well, according to disability, you have to, you have to be disabled, and the disability has to last 12 months or longer, and it has to prevent you from working. That's the definition of disability for Social Security. 12 months or longer, disabling condition, 12 months or longer. And people hear that 12 months. Okay, I haven't been disabled for 12 months yet, so I have to wait 12 months. You can't imagine how many times I hear that. No, no, no. As soon as you stop work because of your disability, so you're working, become disabled, injury, accident, whatever the case may be, as soon as you stop working because of your disability, immediately file for benefits. And I just did a set of 4 or 5 videos on disability within the last month or two. So watch all those videos. It gives you all kinds of insider tips, tricks, and secrets on how to get your claim approved. But yes, don't wait, because you will be waiting. Believe me. Um, you go ahead and file, and they're so backed up. It takes 6 to 9 months to get the initial decision, and if you're denied, that's another 6 or 9 months. So do not wait. Do not wait the 12 months. Too many people say that. I have to be disabled for 12 months. No, no, no. Your disability has to last for 12 months or longer. What does that mean? Basically, again, I've taken a few 100,000 disability claims, and people come into the office. I've had many people come to the office. Yeah, I want to file for disability. Okay, fine. Start the claim. What's your disabling condition? I'm pregnant. Okay, I'm pretty sure in every state, maybe Florida is an exception, but every state, yeah, there's a pregnancy doesn't last 12 months or longer. I think it's under 9 months. Florida might be an exception. I grew up in Florida, so I can harass Florida. So that's what it means by 12 months or longer. Your disabling condition has to last 12 months. So it can't be like a broken arm or pregnant or something like that. Something that's actually going to last 12 months or longer, because Social Security does not have short-term disability. So that's basically what that means. But it doesn't mean you have to wait 12 months to file. Please, please. All right. And number 6 on filing mistakes is thinking you can't file for retirement or spouse benefits or survivor benefits because you made over the annual earnings limit, the annual earnings test for that year, the AET. Sorry, I threw in bureaucratic acronyms in there, but annual earnings test. So this year it's $22,320. So it's April. You're going to stop working at the end of this month, and you've already made $1 million, let's say. And if you made $1 million, please click the link below, buy me a beer and coffee or whatever. But you've made a whole bunch of money already. So you're like, I'm already over the annual earnings limit, so I guess I can't file, so I can't start my benefits until next year. No, 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 no. The first year, Social Security goes by a monthly test. So the first month, you're under $22,320 divided by 12, which is $1,860. So the first month you're under $1,860, then you can start your benefits. And there's no $1 for every $2 you go over and all that kind of stuff. So if you stop working at the end of this month or reduce your earnings to under $1,860, you can start your benefits next month. So call immediately, schedule an appointment, go online, file, make sure you watch my videos so you do the right thing, and all the little gory details and all that, or ask me questions, join my live Q&A, which I do twice a week scheduled. But as you can see, I pop up all the time like a bad penny. Yes. So many people out there need help, and I'm semi-retired and I've got all this information swimming around in my head. So here I am. So there's the 6 right there. So make sure you don't make those mistakes, and please share with everybody else, your family, friends, relatives, to make sure they are not making those mistakes, and make sure you subscribe and all that good stuff. All right. So let's go ahead and answer some of your questions. Kimberly, yes, we need to talk. I've called you a few times, but yeah, just let's see. Okay, there we go. We got a question. Hey, somebody, I'm going to pop it up here. The question, somebody said, hey, what's up? Somebody said, do you have to buy Plan G from the state you live in, or can you buy Plan G from another state that has Plan G for cheaper? No, you have to buy it where you live. So she is talking about Medicare Supplement Plan G. The big ones today that pretty much 99.9% of the people get are Medicare Supplement Plan G or Plan N. And if you need help with those, I've got, again, network partners throughout the country that can help you and get you a Medicare supplement plan or Medicare Advantage, a prescription drug, vision, dental, life, burial insurance, estate planning, all the stuff I saw when I worked at Social Security for those decades, all the stuff that I see people make mistakes in and do the wrong things. So I decided to put together a team and yeah, so give us a call and we can help you out. All right, Kimberly, there we go. We got a question. Hi, Ed. Was wondering, since my son's father passed away and he cannot work due to his disabilities, can he collect off of that? He did get survivor benefits till he was 18. But I'm wondering, because he cannot work due to his conditions, probably not have to go to for SSI for him. Yes, yes. So you are talking about a disabled adult child. What should have happened is, yeah, Social Security kind of misses the boat on that a little bit. They don't provide the information. You can get benefits. A child can get benefits if they're under 18 or they became disabled before the age of 22. So father passed away. He was receiving benefits, and the benefits were probably just because he was under 18. And then they kicked him off because he turned 18 or he was still in high school. If you're still in high school, they can continue basically until you graduate high school. But at that time, what should have happened in a perfect world, if he was disabled, because he had to be disabled before the age of 22, then they would have done a disability application and gone through the entire disability process, and to see if he was disabled and whether he became disabled before the age of 22, which at that time he was 19 or whatever. But that's what should have happened, but it didn't sound like it happened. He was receiving SSI, so that means he is disabled. So yeah, so you really need to contact Social Security, or he needs to contact Social Security, unless you're the representative payee for him, or together call up Social Security or visit the local office or whatever the case may be and file a DAC claim, DAC, Disabled Adult Child Claim. And they'll have to go through everything and see whether he was disabled before the age of 22. And if so, then he will be entitled to benefits on his late father's record for the rest of his life, unless he returns to work or something like that. So yes, so call up Social Security immediately, if not sooner. Savannah, I will try to contact my local stations. I think you would be a very popular guest. Yeah, yes. I did one like in El Paso. It was kind of terrible. I'm still working on this whole YouTube thing and audio and video, and so I know the Social Security part. I know the Medicare part. I know the Medicaid part. I know all that kind of stuff. I've done that for a few decades, but this whole YouTube stuff is all new to me. So don't look at the one I did in El Paso. It's pretty bad. But yeah, it was only a few seconds. I think they cut most of it because it was everything was anyway. So I'll forget about that. Thank you. Yes, I appreciate it. Yes, appreciate it. Thank you. Let's see, Sandy. What's up, Sandy? Hi. Thank you for all the great information. I'm at the reconsideration stage. Can you tell me where to locate a comprehensive listing of the vocational guidelines, the grid rules? Yeah, on the SSA website, and what is the guy's name? Jason. There's a lawyer out of oh gosh, his name escapes me right now. But there's a lawyer out of Florida that does a lot of YouTube videos. There's two lawyers out of Florida. One I'm not a fan of, but the other one, Jason, gosh, but I'll remember his name here. But yeah, he does a good video on. Let me go ahead and do a quick little Google search here. I've emailed him a couple times. We've had a couple. I've helped some of his clients out with the Social Security questions and stuff. So um, really, really, really nice guy, and I feel so bad that I don't remember his name. Social Security disability videos. Jonathan Ginsburg. Yes, watch videos on Jonathan Ginsburg, and he does a great video on grid rules and all that kind of stuff. So yes, yeah, definitely check out that. I don't have anything like that. I haven't done a video like that yet. I definitely need to because I've adjudicated hundreds of thousands of disability claims, but he's done a great one. So yep. All right, Savannah 54 in the chat, only 20 likes. Smash the like button. All right, there's always people out there looking out for me. Chris, the changes coming to Social Security, will that affect current retirees? Yeah, the big political type things, usually not. I mean, politicians and do whatever crazy things, we let them do. That's the key right there. There are representatives, even though they're bought and paid for. But anyway, I won't go into all that. But usually no, because that's pretty much a death sentence for their next election, 2 or 6 years or whatever. So what they'll do is, they'll, whatever changes they do make, it, won't affect anybody that's currently on, retirement, survivor, disability, or anything like that. It's usually, people that, are 10 or 20 years from that. And yeah, and there's so much apathy out there that, that I think that's cooked into the cake as the powers that be want everybody to think, oh, it's just who cares, it's not going to be there anyway, so give it to the billionaires on Wall Street. And yeah, so there's I won't go into more on that. All right, let's see here. We got some TikTok questions. Please, everybody on TikTok, please subscribe so I can do you all right. I need 10,000 subscribers on TikTok to do it correctly. All right, let's see here. I will be 62 in May. I'm divorced and live alone, working still. When can I get Social Security from X's half? All right, so if you are working still and you're making over the $22,320, then anything over that amount, whenever you start your benefits now, because you're doing early retirement, $1 for every $2 is going to be withheld. So every $2 you go. So if you go $1,000 over, Social Security will hold back $500. But if you're under that, then yeah, if you have to be 62 the entire month. So if you were born on the May 1st, you can file in May. But if not, you'll have to start in June. So yeah, June. You can go ahead and start your benefits, and then the June check will come in July. Social Security always pays a month behind like that. So, and but your ex has to be either currently receiving the benefits, retirement or disability, whatever the case may be, or they have to be at least 62 years old. Even if I just did a video on this on a secret spouse benefit that a lot of people miss, is that a lot of people say, well, I was going to file on my ex-spouse's benefit, but he or she hasn't started receiving benefits yet, so I can't file. So they don't do it. And again, millions of dollars being lost out there for people that need it. As long as that person is 62, you can file. It's called independently entitled divorce spouse. I just did a video on that, so make sure you check that out. All right. How can I avoid paying taxes on my Social Security? Yeah, good question. I don't do taxes. Yeah, some states don't tax. So state taxes, some states you can move to a state that doesn't, pay taxes, but federal taxes, there's a lot of variables there. For widows, do they automatically enroll you in Medicare without your knowledge? Yes. Yes. So for anybody, if you're a widow or disabled or retired or whatever the case may be, you're automatically enrolled in Medicare. However, you can immediately decline it. So what happens if, let's say you're coming up on 65, since so many people are turning 65 this year. You're coming up on 65, And about 100 days before that, Medicare will send you your package if you're currently receiving benefits, which sounds like you are. So about 100 days before you turn your 65th birthday, Medicare will send you your package automatically with your Medicare card, Part A and Part B. And if you don't want it, just return the card. They give you a little procedure in there on how to decline it. But again, if you decline it and you don't have health insurance from work, current work, or your spouse's work, and everything I just discussed earlier, then you will be penalized for the rest of your life, 10% for every 12 months. Can veterans qualify for Social Security disability? Can veterans qualify for Social Security disability if they get VA disability? Yes, but it's not automatic. Social Security defines disability differently. I had close to 100 employees in my office, and I'm an old Marine Corps sergeant, so veterans are always near and dear to my heart, and they're easier to hire too for Social Security. They're if you got a certain campaign medal, and they're easier to hire, bureaucratic wise. So a lot of those employees in my office were receiving disability, 10, 20, 30, 40, 50%, but they were working. So for Social Security, that means they're not disabled. Even though you're receiving disability from the VA, if you're working and earning over the limit, then you're not disabled. Okay. So long story short, yes, if you are disabled and that disability is keeping you from working, and your disability is going to last for 12 months or longer, then immediately watch my 4 or 5 videos on filing for disability with all the tips, tricks, and secrets, and then file for disability. And having VA disability does not automatically get you Social Security disability. It makes it easier because the Social Security system talks to the VA system in terms of medical records. So it's easier to get. The process is easier with the VA because everything is electronic-ish. So, all right. Average price plan G premium goes up every year. Yeah. So there's 3 different types of Medicare supplements. There's community pricing, and there's age pricing and issue pricing and stuff. So insurance companies, they're not the biggest companies in the country because they're stupid. It doesn't matter what pricing structure you get once you get a Medicare supplement plan that's available in your area. They every year there's kind of like a COLA, medical inflation, or not a COLA, cost, but medical inflation. So insurance companies can raise the rates, but that's why if you watch my videos on Medicare supplements, I always recommend Plan N, as in Nancy, for a Medicare supplement, a little bit above Plan G. Plan G is awesome, but I think just because of pricing, because I'm cheap, frugal, I like Plan N a little bit more because it's less expensive on a monthly basis now, and I and almost everybody else thinks the trajectory going forward for Plan N, price increase wise, will be less than Plan G. So that's why a lot of people are switching from Plan G to Plan N to save money. So if you're looking for that, again, since you're on TikTok, on my front page on TikTok, I've got my phone number and email. So just call me or email me, and just tell me your name, your phone number, the state you're from, because they're all state specific, and what you're looking for, and we can find someone that works your neck of the woods and give you all your option. And full disclosure, if you enroll with them, they help you out. They help us out. They support our channel and our ability to do all these crazy videos. Social Security sends the company coverage for Part D. Not sure. Yeah, so Part D, so Part A and Part B, as in boy, those are, Medicare, original Medicare. Part D is prescription drug plan, and you get those from private companies. So maybe that's, and then Part C is what they call Medicare Advantage plans. Some people have problem with them being called Part C, but because politicians are working that out now. So that's Part C as of now, Medicare Advantage, and you get those from private companies. And then the Medicare supplement plans, what we were just talking about, Plan N and Plan G, you also get those from private companies. So there's that. My husband is disabled. He has been for 3 years. Why hasn't he got his back pay? Yeah, not sure. So yeah, I would reach out to Social Security if you're recently approved or approved a while ago, and just they approved him, going retroactively, and they, haven't paid him his money. Then make sure, yeah, reach out to Social Security and watch my video on how to deal with the bureaucracy, and it gives you some insider tips, tricks, and secrets on how to deal with that bureaucracy. Okay. All right. Let's see here. Hi, Ed. Dr. Ed. Social Security owes me $4,000 for a back payment that was paid. They put me on a payment plan. Question, have to go to Social Security. How will I take to get my payment? Yeah, it really depends on the nature of that payment. So it kind of sounds like a question I was just answering there for TikTok is if it's a retroactive disability benefits, you went through the whole initial claim on disability, you were denied, you went to the reconsideration, you were denied, and then eventually went to the administrative law judge, and they approved you, and ALJ, administrative law judge, says, okay, pay this man his back pay, 2 years. Sound like a scene from Good Will Hunting there for a second, but anyway. Yeah. How long will it take? Yeah, there's again, same on you. Watch my video I just did this year, a few months ago, on how to deal with the Social Security bureaucracy, and it gives you all the insider tips, tricks, and secrets on how to do that. All right, Alan, I'm 64, took early Social Security and getting VA medical. What plans are available for Medicare Advantage that don't include drug or vision? Yeah, vision's not usually not. Yeah, that's because you don't really pay extra for that. But yeah, good question. Those are you've got kind of insider. You've got the what agents and brokers, Medicare, that do Medicare Advantage, they call them MAPD, Medicare Advantage and prescription drugs. So it's a bundled plan. And then there's just MA plan, Medicare Advantage, without the PD part. So that's what you're looking for. So usually those are like freedom plans and patriot plans and stuff like that, specifically for you, because a lot of vets that have VA medical, they get all their prescription drugs from the VA medical facility, and they're happy with it. So they don't need prescription drugs, and you don't need vision. So yeah, just look for a Medicare Advantage plan, without that. So yeah, and again, you can call the number there or email me and tell me what state you're in and what you're looking for. And if you don't have someone that you know and trust that can help you look and get you enrolled and walk you through all the bureaucracy, then let me know, and I'll have someone in your area that works your area contact you and help you out. That is a free service. My Social Security statement shows an estimate of what I will receive at 70, but that assumes I work and make the same money up until 70, right? Leanne Davis. All right. If I retire at 65, but I wait until 70 to claim it, will it be less? Yes, Leah, we need to put you on this side of the camera. All right. Yes, I'm sure you look a lot better than I do, but anyway, we won't go there. Yes. So yes, a lot of people call me up all the time and they say, yeah, I got a statement a few years ago and it's completely incorrect. Why do they tell us incorrect information? I say, well, did you stop working by any chance? Yeah, I stopped working. So yeah, that's it. Leanne is 100% correct. It's a future estimate. The statement you get on SSA.gov, and I recommend, please, everybody go onto SSA.gov, set up an account. And the reason is there's a bunch of reasons, but number one reason is it protects you. If you go in there and set up an account, even if you never use it, never intend to use it, go in there and set up an account. You put in your email and your phone number and stuff like that. And that way, if someone somewhere in the world decides to go in there and pretend they're you and make trouble for you, you will be notified by email or phone number, because Social Security has your email or phone number because you set up an account. So even if you don't intend to use it, please go in there and set up one, and that protects you. All right. And number two is, we just finished tax season. Every time you finish your taxes, don't put away your taxes until you go into the SSA.gov, your Social Security account, and look to make sure Social Security has the correct numbers. So many people get the wrong benefits. So many people are losing money every single month because they didn't do that. Because Social Security determines your benefit amount by your high 35 years of earnings. So if 20 years ago you worked at some place, but those earnings just didn't make it to Social Security, and now it's a 0 year, that's going to reduce your benefit for the rest of your life. So before you finish your taxes, go in there, check, and say, okay, yep, looks correct. All right, I guess I'll check again next year. So yes, please do that. But that statement you get in your mysocialsecurity.gov account, it says, okay, if you're 59 years old, and it says, when you hit 62, this is how much. When you hit 67, this is how much. When you hit 70, this is how much. It's all based on, as Leanna points out, it's future projections. Social Security says, okay, if you continue to work pretty much like you've been working, last year and the last couple of years, and yada yada, this is how much it's projected to be in the future. But if you stop working, then yeah, all bets are off and those numbers are incorrect. So yeah, but if you wait until you're 70, it's going to be, it's going to be less. But when you wait and get those delayed retirement credits, you're going to get 8% extra every year from 67 to 70. So yes, that's a beautiful thing. Savannah, I'm on SSDI and a widow, higher earner. I want to take my widow's benefit at 67 until 70 of my DRCs. Was told that's not allowed. True. Something about deeming. You're on SSDI, but you're getting widow's benefits. All right, so you're getting watch my video. I'm doing a video this Thursday on DRCs and all of that. Watch that. But I wonder who told you that. I need to know more details on your particular situation, exactly the numbers and all that kind of stuff. And anytime you go into the Social Security office or call the 800 number, you're talking to, I hate to put it this way, but kind of a lower level employee that is trained to help out everybody on a little bit of everything. But for these more complicated type of cases, you really need to see someone in the back, a claims specialist that just does, retirement, widow's benefits and stuff like that. And hopefully they're, on one like this, they will probably defer to the office technical expert. But the deeming is basically, that means when you file for spouse benefits, you have to file for your own first. Before, over a decade ago, there was a strategy that people used where they filed and suspended and kind of worked the system, and but they stopped that. But now, if you file for spouse, and that spouse is living, you have to file. So it's kind of a deemed filing. But it doesn't sound, if you are receiving widow's benefits and SSDI, but you're just receiving widow's benefits. Yeah, so I would check. I would call Social Security and tell them your situation after you watch my video on Thursday, where I give you more details on your DRCs, delayed retirement credits. All right, Ellen. If my ex-spouse has passed away, can I still file for his SSI? Yeah, nobody can file for anybody else's SSI. but you probably just, SSI is supplemental security income. That's the welfare benefits. So if he was on SSI, then no, SSI is he was disabled, or he or she was disabled, and he or she was receiving, didn't have enough credits, or didn't have very much from regular SSDI, regular disability insurance, and therefore they were receiving a welfare type benefit. So no, but if he was receiving SSDI, you can, if you're 62 years old, you can file for survivor benefits if you were married to that person for 10 years or longer and all that. Yep. Cadillac Jack. Hey, Ed, thanks for sharing the information. Yeah, you're welcome. Cadillac Jack. We're regular here. Lisa, what about Medicare Advantage? I am drowning in medical copays I can't afford. By the way, I'm on SSDI Texas. I had a lot of follow-up. Medical copays. Yeah, so yeah, Medicare, again, that's why I kind of recommend Medicare supplements. Again, if you can afford the monthly premium, but if you actually get sick and have to use it, Medicare supplements are I would argue far better, because you don't have all those copays. So if you have some type of surgery, it's $100,000, and you have Plan G, or it's $1 million and you have Plan G, your cost is $240, and you're done, done and done. And you can go any place in the country, any place, any doctor, clinic, hospital takes Medicare. Jump on a plane, go anywhere you want. Oh, I don't like this one, I want to go the other side of the country. No problem. No, no networks or anything like that. Jump on your plane, go over there, pay your $240 for your $1 million surgery, and you're done. With Medicare Advantage, then you have to stay in the network and get permission, authorization from the insurance company to do X, Y, and Z. And then you'll have copays, $100 for, a night, or $200 for a night, and then this and that and all the rest of it. And so, yeah. But if you never get sick, and you have a 0 monthly premium copay with a Medicare Advantage, and you never get sick, and then 70 years from now you shuffle off this mortal coil, then yeah, Medicare Advantage was definitely the way to go. All right, let's see here. Let's see some other questions. SSI over 65, what do they look at? Yeah, so SSI, yes, good point. SSI is supplemental security income, the welfare-based benefit, and you can get it if you are, again, low income, low resources. You don't have, any other benefits, from retirement or survivors or anything like that, above $943. But you can get it if you're disabled or you're aged, and aged is considered 65 or above. So if you're 66 years old, and let's say your only income is $300 from Social Security retirement, then you can file for SSI, and you can get another $643 from SSI. And what do they look at? They look at the fact that you're 65 years old. So immediately call and schedule an appointment, to see if you are eligible. Again, they look at income and resources and all that other kind of good stuff. All right, Donna, if you get a Medicare supplement plan in the 6-month window of turning 65 each year, if you want to change plans, do you get the same benefit of not answering tons of medical questions each year? No, you're outside of your initial enrollment period there. So yeah, you'll probably have to go through medical underwriting anytime after that, unless there's an exception. It's different states do a little bit different things. If you move or something like that, there's all kinds of exceptions. So if you're looking to that, if you move, or you want a different, save some money, your plan is, raising the rates or something like that, or you want to switch from a G to an N, then it's they don't make it easy. So that's why it's always good to get help. And because give my number a call or email me, tell me what you need, and we'll find someone that will help you, and it's no charge. And full disclosure, again, they help out this channel. And how do they do it for free? Is whatever company. I only deal with brokers. So brokers work for you, and they look at all the companies in the area, and they say, okay, based on your particular situation that you told me, here's looks to be the top one or two, three plans in your area, three companies that's going to save you the most money and get you the most benefits and all this kind of stuff, and then you make your decision. So usually agents, work for one company, so they're like, well, this is the old, Henry Ford. You can have any color car you want as long as it's black. So there's that. All right. Okay, Savannah says she's not on a widow's benefit yet. So yeah, yes. So if you're not on a widow's benefit now, if you're just receiving SSDI, then I might have some good news for you Thursday. So yeah, join me Thursday, and I'll talk about that. And you can see in the little thumbnail thing I put up for Thursday's thing on the top right, it says a secret benefit that most Social Security employees don't know about. So I bet you got one of those Social Security employees that don't know about this. It's uh, I worked for Social Security for a couple of decades, and I don't think I've seen more than a handful of people doing it. Probably because we have, not that many people do it, and because of their particular situation, and nobody knows about it. So we're going to change that, and we're going to get people some money, hopefully here. And yeah, I'm 60. When should I need to start the process? So if you're 60, so that means you're kicking around. That's the only comment I got there. So I assume you're 60, so that means you're looking for survivor benefits. So yeah, if you're going to file for survivor benefits, then a month or two before. You can't do that online. Social Security's been adding online services, but survivor benefit isn't one of them. They've been playing around with it for a while, but you can't file online for that. You actually have to call. So you call the 800 number. I wouldn't just recommend just walking into Social Security one day as a walk-in. It's possible, but yeah, it's unadvisable. So you call and set up an appointment. It can be an in-office appointment or a phone appointment. And again, what my number one mistake that I talked about today is on the documentation. So don't wait. You can start getting your documents in terms of marriage and divorce and all that kind of stuff. You definitely don't need the death certificate. Social Security is automatically notified of death of people's passing. So yeah, schedule an appointment and get the ball rolling. All right, let's see here. I'm on SSDI and getting ready to receive my first back pay check. The Social Security office asked me if I owe rent. Will they deduct that out of my back pay to my spouse for owned rent? Okay, so yeah, if you're on yeah, wait a second here. You're on SSDI? SSI office, so you probably mean the SSA office. But if it's SSDI, they wouldn't ask you about rent at all because it's none of their business. But maybe you are receiving SSDI and SSI. So you can receive both SSI and SSDI. So the SSI portion, they would ask you about rent and all that kind of stuff. But they just changed the policy last week for people on SSI, and but doesn't start until September. Now they won't hold that against you. So yeah, I'm going to come out with a video on all of that, but it doesn't take place until September. And they haven't come up with kind of the insider tips, tricks, and secrets on the inside of how it's going to be done. So I want to find out, how the sausage is made before I make a full video on it. Because you can get, general information anywhere on the news and stuff like that, but they don't provide that inside tips, tricks, and secrets like we do here. Let's see, moving to Oregon 1 month before I turn 65. Apply for Medicare here in Boston or wait till Oregon? No, you can, Medicare Part A and Part B is same anywhere. So you can apply for Part A and Part B anywhere in the country, doesn't matter. But in terms of the Medicare plan, whatever you choose, the supplement or the Medicare Advantage, then if you know your zip code, if you know your address in Oregon, um, then yeah, you can go ahead and get even when you're in Boston, you can go ahead and enroll in an Oregon plan as long as you know what your address is going to be, because um, even probably your zip. There's yeah, for Medicare supplements, it's easier. It's usually the whole state. Medicare Advantage, it could be, this side of the street has these Medicare Advantage plans available, and this other side of the street has these other Medicare, because of the way they break the lines and districts and stuff. So, but yeah, so you should be good. Yeah, and that way, if you can be completely prepared and you don't have to worry about that while you're doing your unpacking. You've already signed up for Part A, you've signed up for Part B. And again, if you don't know anybody in Oregon that can help you out, give us a call, email me, tell me, all of that information, your name, phone number. Hey, I'm moving to Oregon. I want this type of plan, or, I haven't decided yet. So I want to talk to somebody and kick around my options. And then I can find someone that can help you out in Oregon. No problem whatsoever. Um, was married 25 years, divorced now 25. I think he gets disability. When can I file for his Social Security? Yeah, he's still alive, so you have to wait until you're 62 years old. So once you're 62, again, you have to file for your own because he's still alive. And then you file for your own, and then you can file for benefits on his record if his benefit is twice as much as yours. Another question: do you have to use Medicare at 60? Well, the only way you can get Medicare at 60 is if you been receiving disability for a couple of years. But at 65, do you have to use it? No. At 65, if the first part of the video, if you're currently have health insurance from work and all that kind of good stuff, so then you don't. Is Social Security and disability different? Social Security is Social Security Administration, so Social Security encompasses, within Social Security, you can get Social Security disability, you can get Social Security retirement, you can get Social Security survivor benefits, you can get Social Security spouse benefits, you can get Social Security, the infamous lump sum death payment of $255. So if you want to leave your loved ones with more than $255 for burial, I realize that's enough. That's why I added to my network partners people that can help you with burial insurance. So if you don't have a bunch of money sitting around and $255 ain't going to do it, then that's why I've added that. So give us a call, email me, and we can find someone in your neck of the woods that can kick around some numbers, give you some quotes on burial insurance. All right. Why is it when Social Security disability and you turn 65, they push you over on Social Security? Yeah, that's just an accounting type thing. When you're on disability, so you start your disability at 30, 40, 50, 60 years old, whatever. And then once you hit your full retirement age, they kick you from disability to Social Security retirement. And just a political accounting bureaucratic thing. It's actually good for you because your benefit amount stays the same. When you get your check stays the same, but now you're free. You don't have to worry about CDRs, disability reviews, and work limits and all that kind of stuff. Now, if you can and choose to work, you can make $1 million a month, and Social Security doesn't care, and they will never kick you off retirement because you're on retirement. So it's good for you. So yes, but one thing that is even better, if you are on a Medicare Advantage plan, because people that are on disability throughout the country, it's very difficult, if not impossible, for them to get a Medicare supplement plan when they're under 65 and on disability. So what they do is they get a Medicare Advantage plan because that's pretty much their only option. But once you turn 65, you're in your golden window again. So a lot of people, Okay, I don't like the pre-authorizations. I'm tired of that. I don't like, the network doctors always changing and all this other. I don't like dealing with the insurance company. I want freedom to go anywhere I want and not have to ask insurance company permission to do whatever. Um, and when they hit 65, they can do that. They can get a Medicare supplement plan, a plan G or a plan N, and there's zero, 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 zero health underwriting. Won't ask you one question about your health. Nothing. So you just, again, call the number, email me, tell me what you're looking for, and we can have someone reach out and say, okay, you're coming up on 65, and here is plan G and plan N with this company and that company, and here's the price, and yada, yada, yada. And yeah, it's a beautiful thing. So a lot of people switch to Medicare supplements once they turn 65 because, especially people on disability, you're on disability, so you're using a lot of health care, and you don't want to deal with jumping through a bunch of hoops. The Social Security have a food stamp program, or can they give you money for food? No. Well, I mean, they give you Social Security, retirement, disability, and so I guess that's money for food. But yeah, food stamps, no. That would be your state your state. Let me put this up here. Medicaid office, and I worked before I worked for Social Security. I worked for Department of Social Services doing food stamps and Medicaid and TANF and all that kind of good stuff. So yeah, no, you just you reach out to the state social services, and if you're on Social Security, then you file for food stamps. And I would recommend you do Medicaid. A lot of people don't recognize or realize you can get Medicare and Medicaid. All right. Let's see here. I tried getting disability, but I'm confused if they are different. No, no. Yeah, you file for disability and retirement, survivor benefits, all of it at the Social Security Administration. And one thing, again, a lot of people don't realize is you can file if you're 62, 63 years old, and you want to file for disability, but you need money. You can file for retirement benefits and disability at the same time. It's called a RIB-DIB application. I did a video on that. Yeah, that way you get some money coming in while you wait, for the 6 months or 9 months or however long it takes to get your disability approved. So you can get both, or you can't get both, but you can file both at the same time. All right, everybody, please press like and subscribe and all that kind of good stuff. I definitely need to watch your videos. Yes. And if you've got any specific questions, make sure you join us here. And again, TikTok, please subscribe. We really need to get to 10,000 subscribers so I can do y'all right and show you all the stuff I show everybody else on the screen there. All right. I've been receiving SSDI for almost 10 years now. Is there a way to receive more? I'm now 65. No, unfortunately. Yeah, you're coming up on 65. So yeah, so hopefully you listen to my rant about Medicare supplements at 65. But again, that's going to get Medicare supplements. There is a monthly premium for that, but some people would rather pay definitively $100, $110 a month or whatever for a Medicare supplement rather than have to pay nickel and dime, Medicare Advantage, $10 for this and $50 for that and $100 for that, and whatever the case may be. So it might save you actually money over the long time. But yeah, for any other benefits, I did a series of videos, and it's titled Living Alone on Social Security, or Living on Social Security Alone. I got 4 videos, and there's 48 different programs in there I talk about that might just help you. So please watch those 4 videos, and yeah, hopefully something will help you. And I apologize. The first video, the intro, everybody complains the intro is just way too long and boring. And so just fast forward through that. I apologize. I'm new to this whole YouTube stuff, so my videos, the content I think is the best in the country, but yeah, the delivery. I'm working on delivery. I got a new back screen. Yeah, anyway, I'm 49 and was denied because of my age. I got a lawyer waiting for court date on disability. yeah, they don't deny you for your age. It's, it's based on, again, if you're working, or if disability keeps you from work, and inability to work. So it has nothing to do with your age. And I've approved, hundreds of thousands of people on disability, and age, was never really a factor. Um, Memories says get Advantage G. G is the way to go. So you're probably mean a Medicare Supplement G. Yes, I agree. Are you talking about Plan G? Yes, yes. So yeah, and a G. Yeah, it really depends on your particular situation, but both of those are perfect. My husband just started Medicare. We have a large pension. It's about 500% cheap or what per month. Okay. Yeah. So people is recommending Plan G, which I would too. Plan N or Plan G is perfect. All right. Let's see here. Let's go back to some. James, what's up, James? When my wife signs up for Social Security spouse benefits, does she have to request her fit and then spousal, or signed up first for spousal benefits? All right. So, yeah, I know it's always hard to type questions in your phone or something, but I think I got it. All right. So yeah, spouse benefits. Yeah. So if she's going to file for spouse benefits, she has to file for benefits on her own first. So she files for benefits on her own. And if her full benefit amount at her full retirement age is less than half of yours, and you're currently receiving benefits, then she files for benefits on yours next. So she has to file for 2 claims. All right. Let's see. How does widow's benefits affect when I file for Social Security? How does widow benefits affect when I file for Social Security? Um, how do, yeah, I'm not sure. So yeah, okay, you're probably meaning Social Security on your own record. Oh, okay. So all right. So that's I think that's one of the filing things I talked about. So if you're on widow's benefits, and you've been receiving that, and you've been waiting, you're super smart and you did it right. You're waiting for your own benefit to increase, and now you called up Social Security and they say, okay, now it's going to be this much, and you're like, okay, now it's time to jump ship. So all you do, you have to file a new claim. So you just call Social Security and say, yep, I want to switch over to my own, and easy, super, super easy. So I'm 62 and applied, and how have Social Security benefits? Will I be penalized if I continue working? It depends how much you make. So this year it's $22,320. So if you're making over $22,320, then with the Social Security withhold $1 for every $2 you go over. So if you make $1,000 over, then Social Security will withhold $500. So yes, yes. All right. It has been an hour and 7 minutes. So I think I've worn out my welcome here today. I need to spend more time on TikTok here. All you guys on TikTok are awesome. So thank you for all the awesome questions. So I'll answer a couple more TikTok here, because y'all are going to subscribe and put us over that 10,000 mark so we can do you right. How does Social Security work if you move out of the country? Social Security, for most part, if you're a U.S. citizen or green card holder, there is it shouldn't be an issue. If you're a U.S. citizen, you can live anywhere anywhere in the world except for North Korea and Cuba, and you're good. So I haven't met anybody that wants to go enjoy the nice beaches in North Korea. But if you're not a U.S. citizen, then go on to SSA.gov and go to the Payments Abroad screening tool, and it'll give you more details. But if you're a U.S. citizen, then you're good. Yep. You just have to worry about Medicare when that time comes, and debate whether you want to file for Medicare. I just did a video within the last few weeks about living overseas. So watch that one. Gives you information on Social Security and Social Security and Medicare and all your options and stuff like that. So watch that video. And if you have any other questions, come on back. I know you can find us because I know you subscribed. I have a back injury and haven't worked since 2015. Can I still apply for SSDI? Yes, always apply, and whether they approve you, that's, it's a whole different situation. But yes, Social Security, you have to be insured. So that means you had to pay into this, system for, usually 10 years. Um, and you have to be currently insured. So if you worked for 10 years in your 20s and now you're 55, so you work for 10 years and you haven't worked since you turned 30 years old, you're insured. But now you're 55, you haven't worked in, what was that, 25, 35 years? So Social Security has insured 10 years and currently insured. That is, did you work 5 out of the last 10 years? So you haven't worked since 2015. So you haven't worked in the last 10 years. So they're definitely not going to approve you, starting, this month. But, you can make the case, go back, and for whatever reason, there's always exceptions, exceptions, exceptions. And, they might, start your benefits in 2015 or something, the case may be. So, yeah, it's going to be tough. It's going to be tough. But I don't know your particular situation. So I would recommend filing and let Social Security make a definitive decision based on your case and look at your work history and all that other kind of stuff. So I am applying this week for Social Security retirement. I'm 62. How long will this take after applying? Pretty easy. I've done millions of retirement claims, and I usually got them done. They come into the office, I do it all, takes 20 or 30 minutes, and by the time they walk out of the building, I've already adjudicated the claim. But I don't know if you did it online, or there's so many variables. If it's a new employee, that person's everything has to be reviewed, so that takes a while. So, but regardless, how long it takes, if you're entitled to benefits this month, and it takes them a month or 2 months to adjudicate the claim, they'll give you your benefits, with the month you actually filed. Or first part of this video, your protective filing. So if you called last month or 2 months ago, they will pay you all that back. Not only the date, the month you filed, but the month you called. Again, if you're entitled, if you're at least 62 during that time. So yeah, it shouldn't take all that long. Retirement is pretty easy. How much is disability? So when they stop yours, how much is disability? Yeah, it really depends on how much you paid into Social Security. Is it monthly for Medicare Supplement G, and how much is it? Yeah, it's a monthly premium for Medicare Part G and Part N, and it really depends on your particular area. Average, I've seen the lowest is about 70s, 80s dollars a month. Average about 110, 20, $30 or something. Places like New York are like 2 or 3 or 4 times more expensive because they have different laws there. Which are actually good laws, but it makes it expensive. So yeah, give us a call, and we can give you your numbers and give you your quote and tell you how much it's going to be in your area, and so you can make a informed decision. A child diagnosed from birth with autism, never filed, can they apply as adults? Is it retroactive? Yeah, if they were disabled before the age of 22, absolutely. Have them apply as a disabled adult child. If one of their parents is receiving Social Security or disability, or SSI, the Supplemental Security Income. Yes, apply. And again, watch my videos on disability, because it's still disability. It'll give you all kinds of tips, tricks, and secrets on how to do it. I am 58. Husband passed away. Sorry to hear that. We're not legally married. He was on disability. Yeah, unfortunately. Well, I don't know if your state accepts common law, because Social Security has to follow the state when it comes to marriage. And if your state accepts common law marriages, then that might do it for you. So, all right. Let's see. This will be the last one here. Savannah, my mom got a Plan N at the age of 88 and saved $140 a month from her previous plan. So far, she's happy and the cost won't go up as fast as Plan G. That's exactly why I recommend Plan G, or excuse me, Plan N. Because, yeah, there's Plan N. There's a couple of small little things that usually are not an issue in terms of coverage. But yeah, and the trajectory of prices going up and how much you're going to save immediately almost always overshadows the couple little things on Plan N. But yeah, if you want someone to see if they can switch you from a G to an N, or a Medicare supplement, Medicare Advantage, yada yada yada, then give us a call or email me and we'll take care of you. All right, that is it for today. Hour 15 minutes. Make sure you subscribe to everything, like, share, and help us out. We need to get the information out there. Y'all have an awesome, beautiful night, and we'll talk to you next day. Take care. Bye-bye.